grand rounds of every month is time to do physician wellness. This is a requirement for all programs or residency programs nationally with the Accreditation Council of Graduate Medical Education. So that's why our grand round series are not just for third and fourth year students, but all affiliated sites, and very important. I'm real excited. We've got a partnership with Lending Hearts, a wonderful organization, and see Vassal's here today, and she'll help introduce things with us. And they have been really partnering with us and helping us, especially with the physician wellness. And you'll find a couple of these each year. They've kind of identified some real outstanding speakers to present to us. Without further ado, I'll turn over to the executive director for Lending Hearts. So please, it's all yours.
Thank you, Dr. Rowain. It is a great pleasure to be with all of you. We've been doing these now since the spring of 2024, and it's amazing how quickly time flies. But I quickly wanted to share Lending Hearts is an organization that I started 15 years ago. We're based in Pittsburgh, but we provide services nationally, providing free emotional, social, and physical support to those living with cancer and their families. And it is so important to our organization to focus on the wellness and the care of our patients and their families as they navigate treatment and beyond, managing those stress levels, their health, their nutrition, everything that comes along with it. So in working with all of you at LECOM, this is so important to all of us because we know that this is such an important topic of wellness for your well-being as well. Today, I am so pleased to introduce to you one of our instructors, Aimee Lamendola. She is beyond a fabulous human being, but what she delivers is also just as exceptional as she is. Every week, she leads a resilience class for our members that is over Zoom, and next week, she will be starting a special monthly class focusing on these particular areas, giving the tools that everyone needs in navigating the waters of life. As I feel we all experience ups and downs and all around. And Aimee is going to share more with all of you today on all of that. Before I share my screen for your slides, I wanted to share, just like in all of our past sessions, we will, in the chat box, there will be a link to a survey. We value your feedback and would like to hear back from you. So upon the completion of this presentation, please just take a moment and complete that survey. So let me send that over to all of you, and I believe I can share my screen. And I will get those slides up now as soon as, let's see where. And Aimee, I welcome you to take over.
Thank you so much, Vaso. Thank you all for having me. It's really a privilege to be here, especially on behalf of Lending Hearts. As we begin, I want to acknowledge what all of you know, which is the career that you have chosen is both deeply meaningful and demanding. Each day calls you for new learning, greater responsibility with steady focus in the midst of uncertainty and intensity. And the ACGME recognized this reality when it embedded physician well-being into the common program requirements. As Dr. Rowain said, asking every program to provide tools for self-care, fatigue mitigation, and personal well-being. So the standard was written for you in mind, the students, the residents, the physicians that you're becoming, and hopefully the habits that will sustain you across a lifetime in medicine. But I want to be clear that this isn't about being less driven. It's about being driven and well. So caring for patients begins with caring for yourself, because the state that you bring into the room shapes the care that follows. And the ACGME's call invites us to look honestly at the toll the training can take, and then to explore practical, evidence-informed ways to reduce burnout and reconnect with meaning. So while well-being is shaped by many forces, including systemic and structural factors in training, today we will focus on individual skills that we can practice in real time within the time constraints of your day. We'll look at awareness, mindfulness, specifically mindful breathing, and a meditation called loving kindness. These are evidence-based tools that help us meet the demands with greater steadiness and resilience. They're not about stepping away from your day, but really about finding steadiness within it. And one important note as we begin, these aren't concepts to just understand intellectually. These are practices to experience, to build a skill. And like any clinical skill, they become useful through repetition. And my hope is that you won't just hear about them today, you'll give yourself the opportunity to experience them through guided practice. And it's my hope then that you would keep on exploring them on your own. Next slide. And before we go further, let's be clear, we're not doing a full mindfulness or meditation program today. We're just beginning a conversation, learning a few mindfulness-based interventions that will fit within the pace of your day. The ACGME framework reminds us that physician well-being isn't the absence of burnout, it's the presence of balance, connection, compassion as professional competencies. It calls us to notice fatigue and emotional strain as shared human experiences. This is amongst each other and even with your patients. And then to strengthen skills that support your well-being, that support teamwork, support empathy and clarity.
I think it's
I want to highlight 2 reviews and 1 study that illustrate how these skills support well-being in real clinical contexts. Just very quickly, a 2023 systematic review in Advances in Health Sciences Education examined 31 studies of mindfulness programs for medical students. More of half of those were randomized controlled trials. They considered brief being 4 to 7 week programs, and then a standard 8 to 10 week mindfulness-based stress reduction course. Both consistently improve stress, mindfulness, self-compassion, with those effects lasting over a year. And the interventions, they address the core challenge in medical training because they support emotional regulation and resilience. Okay. The second review I want to highlight may be of more interest. It's a 2017 systematic review published in the American Journal of Medicine. And this review is relevant for clinicians who are pressed for time, which I assume that's all of you, because it focused specifically on brief mindfulness interventions, those requiring 4 hours or less of total practice. And the authors examined studies that just tested short mindfulness practice with hospital-based providers and evaluated changes such as stress, anxiety, mindfulness, resiliency, burnout. 14 of these studies met inclusion criteria. 7 of them were randomized control trials, like I said, half. The takeaway at the end of the review is that even with very small time commitment, clinicians experience meaningful change. It did conclude that brief mindfulness interventions may be effective for improving provider well-being. It does call for larger studies to evaluate impacts on clinical care. But aside from those 2 systematic reviews, I want to mention 1 long-term study because we're going to use something out of that. It was an 8-week mindfulness course for healthcare professionals, and they were followed for 18 months. And they too showed sustained reductions in burnout, especially depersonalization, as well as increases in acting with awareness, non-judgment, and non-reactivity. And when the researchers asked people or the participants what they were actually using in daily life after the course was over, the skill that it wasn't long-term meditation or yoga, it was this 10-second micro practice they called Stop, Breathe, Be. It was a brief reset that clinicians could use in real time at work, and we'll take a look at that later. So even a single mindful breath before you enter a room, I know this seems simple, the beauty is in the simplicity here. A moment to gather yourself before delivering news, a brief pause to just feel your feet under you. These tiny moments activate the same attentional and physiological pathways that were studied in the longer programs. Next slide. But awareness is really important because we can't change what we're not aware of. And so as you're looking at this slide, it's worth noting that not all stress is harmful. Stress can signal engagement. A healthy dose of stress activation helps us mobilize, focus, and respond. That is short-term adaptive stress. Could be called eustress. It can sharpen our performance, deepen learning. The body and brain are built for it if they have time to recover. What we're focusing on here isn't mobilizing energy. It's another kind. It's unmitigated, ongoing, unrecovered stress where demand consistently exceeds perceived resources, and it leads to anxiety, depression, and burnout. And over time, that state becomes less about readiness and more about depletion. Many of us know it well. It's the one that runs on urgency and caffeine, where the mind races, shoulders tighten, breath shallows. There can be a real hum of effort under everything we do when we're here. And on this illustration, I've included just some of the chronic stress signals that I've kind of gathered from people from over the years. I will say that you have your own patented formula of your own mind-body behavior. You'll notice that there are physical sensations here. Stress is not limited to the body. Those sensations come with generally negative thoughts, right? We don't tend to be real positive or kind to ourselves in our inner dialogue. We often say things that we would never say to someone else. You can take a look at some of those things like, I'll never get it done. If I slow down, I'm going to fall behind. Everyone's doing it better than me. I can't do this. But emotions are closely paired with the tension in the body and the quality of our thoughts. So this is where we feel anxiety, irritability, the tired but wired feeling. And what's important to note is that the behaviors, it's very easy to kind of fall into the patterns of maladaptive coping here. And those actually compound stress. So this could be eating too much or too little, numbing out through drugs or alcohol. Sometimes we just push harder, isolate, pull away from our family, from our friends, from our social supports, or even aggression. So while this strategy works, it works until it doesn't. When recovery never comes, stress shifts from motivating to erosive. It can dull empathy and drain meaning. The good news is that the stress response itself isn't the enemy, it's just these signals asking for a reset. And the same system that holds the tension knows how to release it. And let's look at how recovery unfolds. The well-being body. Next slide. Also, can you go to the next slide?
I am trying.
Oh, okay, sure, I'm sorry. I'll just start to talk to you here because you could even get a sense of it in your own mind. So if that is the stress body that you're looking at, the counterpart is what I refer to as well-being, the physiology of recovery. Here it is. And this isn't the absence of stress here. It is the presence of regulation. The system finding a more natural rhythm again. There is efficiency here. It's a more efficient state. I have found, we need to be aware of this state as well, but in working with people in all different areas, that naming this in the body is actually more difficult than identifying those signals of chronic stress. So often I hear that the physical signs are just the absence of tension, and that is a great start to be aware of it. I often hear that there are appropriate levels of energy, a more steady but ready feeling versus the wired and tired. Energy shifts from really feeling like you have to push to being sustainable. And sometimes the breath naturally deepens, although we might not be aware of it. Shoulders soften, jaw might not be tight. And emotionally, there's just more space. Might feel like calm, might feel like ease, present, confident, curious, appreciative. Irritability tends to ease, patience returns. We can tolerate uncertainty without feeling overwhelmed. And the thoughts, they generally become more orderly or kind. I can do this, right? Instead of I can't. Attention studies, it's easier to prioritize. Clarity kind of replaces that scattered, hurried mind. And behaviorally, here's important too, our choices begin to shift in small but meaningful ways. There tends to be more balance in our behaviors. So we can pause before react. We ask for help when we need it. We'll take a walk instead of numbing. These are signs of the nervous system returning to balance. So the state, again, isn't about being less driven or less committed. If anything, we become more effective. And the goal is not to live here all the time, right? The real skill is the recoverability, noticing when we have drifted into that stress physiology for a long time, and then knowing how to guide ourselves back. So just like we learn the stress signals of the body, we need to learn the signals of the well-being body too, so that we know what recalibration feels like. It really is a foundation of self-regulation and sustainable well-being. And again, it's not something to achieve later. It is something that we move in and out of just with more regularity and practice. Next slide. So the next slide we'll talk about here is we've looked at how stress shows up in the body and how recovery begins. The next natural question is, how do I train that awareness in the real pace of medicine or my day? And that's where mindfulness comes in. It's a kind of attention, a quality of noticing. Go back one slide. Mindfulness simply means paying attention to the present moment on purpose without judgment. I'm sure many of you have heard that. And again, it seems simple. It's just not always easy to embrace. But mindfulness, arguably, is one of the most studied and most practical methods to become aware of and also interrupt the stress cycle. Being present helps us notice what state we're operating from. Am I in that chronically stressed body, or am I in the well-being body? And how do I get back there? Mindfulness takes us off of autopilot because that stress can start to be so familiar that forget that there's another operating mode. The stress body, but mindfulness, like any innate ability here that we have, it can strengthen with practice. The world is full of so many interruptions, alerts, and competing demands, even without our phones. Our minds are pulled forward into worry very easily and backward into rumination. We know what mindful moments feel like, right? Ruminating about what happened while trying to complete documentation, driving home and realizing we can't even recall part of the commute, reaching the end of a snack, salty or sweet, without remembering that we ate it, half engaging with our peers because the mind is already on the next task. These are just normal byproducts of overload and habit of the mind. Mindfulness helps us catch these moments by practicing and with intention, bringing attention back to the present moment. When we can see our signals clearly, without judgment or trying to justify them, we create a small space between that stimulus and response, and that's where the space or choice lies. And it's how mindfulness begins to interrupt that stress habit loop, the automatic tightening, rushing, reacting that often goes unchecked. There's a reason that mindfulness has spread across cultures and professions, is that everyone faces this fast-paced distraction and the time traveling quality of our mind. And the very reason it's hard to practice is the very reason we need it. We all benefit from remembering how to return to the present moment. And mindfulness is trainable, but the pace of medicine doesn't allow for long pauses or quiet rooms. That's why the most practical training is that we can do anywhere within the busyness of your day. And among the ways to practice, which there are many, the breath is the most accessible. It's very portable, it's always available, and it instantly connects the body and the mind. Next slide. So mindful breathing. It simply means bringing your attention to the breath. Not about taking big breaths. It's not about trying to change it or manipulate it. It's about letting your mind rest on the natural rhythm of breathing. The breath connects body and mind in real time. It's always available, always present. And here's the interesting thing. You cannot experience a past breath or a future breath. So when you feel your body breathing, it will anchor you what's happening here right now in the present moment. And it doesn't take long to be beneficial. Across cultures, traditions, people have noticed that awareness of the inhale and the exhale steadies the body and mind. And research echoes what many people have observed, that paying attention to the breath helps return the system to balance. It was a small pilot with 23 physicians, found that even a single intentional breath taken at key moments in the workday was associated with reduced emotional exhaustion and perceived stress. It was brief, it's feasible. I think it sets this precedent that even micro moments of mindful awareness can shift well-being, even in your busy day. Just want to touch on this briefly because I'm often asked what kind of breath. Doesn't matter. I already said just pay attention to it, because there are many patterns of breathing. And when we're talking about mindful breathing, we're less concerned about rate or quality or pace. I am often specifically asked whether it's better to breathe slow or extend the exhale. And a large randomized study of nearly 400 adults compared slow breathing, which should be about 5.5 breaths per minute, which is pretty slow, with more typical paced breathing, which is about 12 breaths per minute or higher. Both groups improved in stress, anxiety, and well-being, with no significant difference between them. It was the mindful attention itself, not the specific rate of breathing, that appeared to drive the benefit. There are studies that compared longer exhale patterns with equal length breathing. This was actually in coherent breathing, so that breathing 5 breaths per minute. It showed that when breathing was just slow, intentional, mindful, there was no consistent physiological, psychological advantage, one ratio of the other. So in my experience, whether physicians, patients, executives, simply returning to balanced, mindful breathing is reliably grounding. And again, it doesn't require equipment, timing, it just requires repetition. A single mindful breath can interrupt that stress activation loop. Many small returns across the day begin to shift baseline. So whatever breathing pattern you choose, just placing your attention on the breath slows the train of thought, brings you to the present moment. And in a moment, we're going to experience this together. So the mindful breathing practice, next slide here. I'm going to be guiding you. And before we begin, I know that some of you, I don't know how many, could be walking, even driving, I suppose, or moving around campus. If that's the case, you're not going to close your eyes. I just simply listen and follow along. However, this will be just a couple of minutes. And I know that I've said these practices can be done in just a few seconds, and that is absolutely true. But today we have the space to slow down a little bit because I carved it out for us. If you are in a place where you feel safe and comfortable, I will invite you to close your eyes, but you don't have to, okay? Sometimes closing the eyes can make it a little easier to settle in, but it is not required to experience mindful breathing. And one more note, your mind will wander even in this couple minutes together. And when you notice that, simply come back to your breath. That's it. Even if it happens 100 times, it's the noticing and the returning that is the strength of practice. So if you're able to, take a seat, place your feet flat on the floor, sit in a way that feels supported and steady. Maybe find a little extra length in your spine. Let your arms rest wherever is comfortable. And if you feel safe doing so, you can go ahead and close your eyes. And just simply become aware of your body breathing. Become aware of where you feel the breath in your body. You breathe all day long, but right now you're placing your full, undivided attention on the sensation of breathing. Maybe you feel it in the nose and the throat, or perhaps today you feel it in the chest, or maybe you feel it through the abdomen and the ribs. But wherever you notice the breath, that's where you will rest your attention. At the end of the inhalation, just relax and let your exhalation begin. And again, at the end of the exhalation, again, relax, let your inhalation begin. And as you continue to follow your breath, see if you can relax your mind so that you have a relaxed but steady focus. And to support that focus and reminder of what you're doing right now, you might even say to yourself in your own mind quietly, breathing in as you breathe in, and say to yourself, breathing out as you breathe out. Breathing in as you breathe in, breathing out as you breathe out. Just a couple more breaths in this way, simply aware of your inhale and your exhale. And just simply notice if anything feels slightly different, maybe a hint of steadiness, a slower internal rhythm, maybe nothing at all, and that's okay. And if your eyes were closed, you can go ahead and open your eyes. Good. So next slide. So I understand that the reality of medicine is that these longer, even 2-minute pauses could be rare, and that most days there isn't time to step away for a full break like that or a meditation session. That's why I want to come back to stop, breathe, be. Remember in that 8-week mindfulness program I mentioned earlier for healthcare professionals, every single participant, it was 100%, used this practice, even at the 6 to 18-month follow-up. All of them used a 10-second reset during their day. They called it pause, breathe, be. It's as simple as feeling one complete breath start to finish. And when might you do that? Maybe before opening a chart, before walking into a patient room, before answering a page or an email. Maybe you do it before you begin to study, or use it after an exam for recovery before you move on to the next task. It's simple, it's fast, it's repeatable, it does generate steadier focus, and it shifts your attention from doing to noticing. And it's not about changing an outcome, it's just about changing how you enter the next moment and repeating this stop, breathe, be, these small resets, really over time, condition the nervous system towards recovery than reactivity. These little micro interventions, measurable in seconds, but cumulative over time, right? You deserve one breath before the world tugs at you again. And take that one moment for you to become more steady, to center. It's hard to remember to practice though, right? Um, let's see, well-being though isn't only about regulation. It's also this capacity to reconnect with care and empathy. And that's what I want to look at next. Next slide here. The ACGME includes meditation among the evidence-informed approaches to physician well-being. One type of meditation we'll look at today is loving kindness meditation, sometimes referred to as metta. This practice strengthens what is already there, a natural capacity for goodwill and kindness. At its core, loving kindness is simple. It's deeply human. We just intentionally offer phrases of care, first towards ourselves and then outward to others. And yet, even though compassion is central, probably to why many of you chose medicine, it's fair to acknowledge that it can get buried under the pace of work, the constant task switching that you have to do, the cognitive strain of decision making, the emotional demands, and a lot of this accumulates, right? So under stress, compassion doesn't disappear, it just can be harder to access. And loving kindness can help us counter what psychologists sometimes describe as that downward pull or negativity bias. And it reactivates an upward spiral of positivity, empathy, connection, meaning it's just one way to restore balance when the demands of training pull you towards the depletion. And there's some evidence that supports this. This was a 2014 randomized trial by Emma Sapala. More than 100 adults were included. They were healthcare professionals and trainees, and they were assigned to loving kindness meditation, positive imagery exercise, or to a neutral control. And even after a single 10-minute session, the loving kindness group experienced greater compassion, more positive emotion, stronger social connection, and less self-focus compared to both control conditions. The study was not presented as a cure for burnout, but it did demonstrate that even moments of intention and goodwill can shift emotional and cognitive states in ways that matter. Right? So it's not just a concept, it is a felt experience of kindness, beginning with ourselves. So just as we did with mindful breathing, I'm going to guide you through a brief loving kindness meditation. Again, this practice will be a little bit longer. I will tell you that. And again, because we've carved out the time for it. You don't need to achieve any particular state or create any feeling. Loving kindness simply invites you to touch into the care that's already there, even if it feels quiet beneath fatigue or even distraction today. We'll try to tap into it. Again, if you're driving or walking around, you're going to keep your eyes open. But if the space that you're in feels safe to do so, I'd like you to give yourself this time, this gift of reducing distractions, even if it's for the 7 minutes together. Go ahead and take a seated position if you can. Let your position feel supported. Feel your feet on the floor. Let your hands rest easily. Let your shoulders begin to soften. And if you can close your eyes or just simply lower your gaze. And much like you did earlier, just be aware of your body breathing to help bring you to the present moment. We'll begin with some phrases. It will begin with yourself, but to get in touch with the feeling of kindness, of warmth, of compassion, I'd like you to bring something or someone to mind that you feel appreciation or gratitude for, even in some small way. Let that warmth settle in. Allow your body to soften. And I want you to repeat these phrases while maintaining that feeling of warmth. I want you to say to yourself, May I be well, healthy, and strong. Say to yourself, may I be happy. May I abide in peace. May I feel safe and secure. May I feel loved and cared for. You let these words just land lightly, nothing to force. The intention itself is the practice. Now bring to mind someone whom it would be easy to extend those same well wishes. This could be a partner, a friend, a family member, a colleague. Just picture them with the same softness and warmth. Hold them in your mind's eye and say to them, may you be well, healthy, and strong. May you be happy. May you abide in peace. May you feel safe and secure. May you feel loved and cared for. I'd like you to now invite into your own mind and heart. Perhaps it's a group of people, could be your family, extended family, a group of friends, even patients, colleagues, but let them come to mind. Hold them in your mind's eye, and with the same strength and loving kindness, say to them, may you be well, healthy, and strong. May you be happy. May all of you abide in peace. May all of you feel safe and secure. May all of you feel loved and cared for. Call to mind someone whom you have a current challenge or difficulty. This doesn't have to be the biggest one in your sphere of influence right now. But hold this person in your mind's eye and in your heart and say to them, may you be well, healthy, and strong. May you be happy. May you abide in peace. May you feel safe and secure. May you feel loved and cared for. This practice always ends with self. So again, say to yourself, not the professional version of you, but simply as you, as a human being, doing your best. May I be well, healthy, and strong. May I be happy. May I abide in peace. May I feel safe and secure. May I feel loved and cared for. And then simply notice now what is present. Warmth, ease, neutrality, nothing. If you sense even the slightest softening or steadiness, let that be an anchor for you today, something that you can return to. And when you're ready, if your eyes were closed, you can open your eyes and just know that loving kindness can travel with you. A quiet intention between tasks, a breath before entering a room. It's a reminder of our shared humanity in the middle of a demanding day. So on the next slide, also we actually may have to go one more. All right, yep, loving kindness and action here. So what we just practiced isn't meant to stay in a quiet room, and I promised you that you would have practices or skills that you could use within the pace and pressure of clinical life. And loving kindness doesn't require extra time. It doesn't ask for a meditation cushion or a silent space in the way that we just practiced. That's one way. It can show up as intention, small, steady reminders of how we want to meet the next moment. So before walking into a patient's room, could you pause for one breath? May I meet this person with steadiness and care. Between tasks, at the end of a long shift for recovery, could you offer yourself, may I be well, healthy, and strong? And these phrases don't slow the work, they just have the potential to change the quality of how we enter it. So under stress, attention, remember, attention can narrow and empathy can fade. The intention here just gently widens the lens again, just reconnecting us with the human being in front of us and inside of us. Each small wish of kindness for yourself or someone else, it really, it strengthens your own well-being. So these micro interventions, they support steadiness in moments that could feel otherwise really rushed or reactive, right? And over time, they do accumulate. So let's just revisit the bodies here. Next slide, I call them the bodies. These are my illustrations. So we explored these simple ways: awareness, mindful breathing, intention of kindness, and each of them help shift the balance from stress to well-being, or at least turn the dial down on the intensity of the chronic activation. On the one side, you hear the illustration of the chronic stress body, the tired, hurried, reactive, and on the other side, the well-being, more balanced, clear, and responsive. We move between these many times of day, often without noticing, but what we practice today is the ability to notice where we are and then to shift even slightly towards greater steadiness. Again, a single breath, moment of awareness, a quiet phrase of goodwill, each one small, but each one has a real physiological recalibration. And the pace, I know, doesn't slow down for you, but within that pace, you can have a quality over the influence, or the quality of your presence. Sorry, you can have an influence on the quality of your presence, on how we speak, listen, enter a room, or even shift from task to task. These brief moments of recovery, they don't remove the stress. I want to acknowledge that. But they can help us meet it with more clarity and compassion, both for ourselves and around us. And over time, that can shift our baseline. And these practices connect us back to whatever we consider our professional identity to be. These inner capacities for training, skills of mindfulness, greater awareness, increased capacity for kindness. They're not separate from medicine. They're a part of how we think, make decisions, collaborate, care with presence. Next slide. So what we've been practicing today, they're not just wellness tools, they're examples of professional capacities, self-awareness, self-regulation, these skills that the ACGME names as core to physician well-being and effective patient care. Self-awareness means noticing what's happening inside, tension, fatigue, emotion, and understanding how those internal states shape our communication, our decisions, interactions. Self-regulation is the ability to pause, to adjust, to respond with clarity, rather than reacting or just staying on autopilot. Every mindful breath, every small pause, every intentional reset is a moment when we're practicing these competencies in real time. And as those moments, as you take them, they do ripple outward. So they steady your tone, improve your attention, but they also support teamwork and the care that you provide. So it's a good time to just reflect gently without judging or overjudging. Am I aware? Am I present in this moment? and my being kind to myself and others. And these aren't tests, they're just touch points. They're small invitations to come back to presence, to reconnect with the kind of clinician and human being you want to be, to move forward. So the ACGME includes these not because they're abstract ideals, but because they sustain empathy, judgment, collaboration over an entire career. So the next slide here, and then we'll wrap up. So here's a quick practical framework that you can apply directly in your day. Here's what it could look like in clinical life or during your studies. Small, repeatable resets that take only seconds, the kind that you can use in rounds during exams, middle of call night, right? When I notice my stress signal, name it. Isn't it my body? Is it my emotions? Is it my thinking? I will take a mindful breath. I will stop, breathe, be, or offer myself or someone else a kind phrase. You could also do it before, during, or after. You could pick specific moments during your day. Again, they don't require extra time. It's just one way to integrate them. These tiny patterns really link your awareness into action. It helps you create steadiness between tasks and for the next moment, one breath at a time. Go ahead, next slide. Last slide, I'm going to get you guys off early. Medicine asks so much for you. Precision, endurance, compassion, often all at once. And beneath all of those skills lies the same intention, which is to heal, to help, to serve. The ACGME's call to physician well-being isn't just something extra. It's recognition that how you care for yourself directly shapes the care for others. And moments of awareness, mindfulness, small acts of kindness strengthen that foundation. It is kind of an inner side of professionalism that helps us think more clearly, maybe listen more deeply, collaborate more wisely, stay connected to meaning in the middle of pressure. And there's no finish line here where self-care becomes unnecessary, right? There are just hundreds of small moments in a day when we can pause, we can return and remember how you do this work. Every mindful breath, every reset, every tiny act of kindness and compassion, even one that is offered silently, is a way of honoring the purpose that brought you here. You deserve it. So, to conclude, caring for patients really does begin with caring for the person who provides that care. When we support ourselves with presence and kindness, medicine becomes not only sustainable, but profoundly human. So thank you for the care that you give and taking this time to care for yourself today. Appreciate you all being here. I think thank you so much.
Well, thank you so much, Ms. Lamendola. Really appreciate it. This series is very important. Just to share with you, that's, I think part of these skill sets that are coming in is we are in a very rigorous, you got to understand, we're a profession that was excited because we created a work week that could be 80 hours, double everyone else. And before that, Chris, I'm getting into stories back in the day when I was that didn't exist. It was a pipe dream, but still, these areas are very, very helpful. And I can share that I had some other colleagues who were in military situations where they had to develop some of these kind of skill sets to just because very brief moments, critical times to reset themselves to survive and making through it.
Mm-hmm.
But, we've got a stressful job. We have to find tools that help us help other people. And I really appreciate this. It's very helpful. I was also happy that I was taking part of things that I didn't, getting really relaxed. I said, if I get too relaxed, I might be out here. But it was awesome. It was good. So thank you very much. But these are great, and they're short, they're brief things that we can easily do. So thank you so much. And
thank you.
Yeah, really great stuff. So thank you again. Very grateful for that. And fill out
everybody,
the survey,
thanks.
everyone. Please fill out the survey if you can. That really helps quite a bit.
And I'll add that I added in the chat box our website. If all of you are always welcome to take part in any of Amy's classes that we offer.
Mm-hmm.
So please, you can go to our website, lendinghearts.org, and register for any of them. We welcome you. We also have classes of hers that were previously recorded on our YouTube channel. But, you know, I did want to leave it open if anybody had any quick questions. If you wanted to put in the chat, I can relay it.
Yeah, I'm just going to say, if you do like listening to loving kindness, I know there is one of those in the Lending Hearts library. Sometimes it is helpful to be guided if you have a little bit of extra space and time. And then I think it's next week. I'm actually doing a deeper dive into the loving kindness meditation.
Yes, next Wednesday
If you're
evening.
interested. Mm-hmm.
So
Yeah.
I
All
don't
right,
see
everybody.
any questions coming in, but thank you all for having us.
Mm-hmm.
Yeah.
Take care, everyone.
Thank
Yeah,
you.
take care.
Mm-hmm.
Don't go anywhere. We have another presentation.
Yes. I'm doing that with Dr. Marion, so we are hanging on.
Yep. I'll wait until 1 o'clock just in case people rejoin.